Diabetes is a chronic condition that causes glucose levels in the body to rise. The problem is ignoring or writing off the symptoms as something else can lead to more serious health complications later on. Left untreated, diabetes can lead to heart disease, stroke, nerve and kidney damage, vision loss, and more. Even if you have mild blood sugar elevations, you can damage your organs. Diabetes is a common condition. The Centers for Disease Control and Prevention estimate more than 34 million people have diabetes in this country, with nearly 95% of those cases type 2 diabetes and about 88 million more are prediabetic. Type 1 diabetes is usually diagnosed during childhood. In contrast, type 2 diabetes can develop at any age but is more common in older populations. Don't miss something important. 12 signs that may indicate you are at risk for diabetes. Number 1, frequent urination. Urinate frequently is a classic symptom of diabetes. Normally, the kidneys are able to filter the blood and send glucose, sugar, from the blood to be reabsorbed back into the bloodstream. When blood glucose levels become high, the body starts to make more urine. This is because the kidneys are not able to reabsorb all of the extra glucose and direct it back into the bloodstream. When this happens, the extra glucose ends up spilling over into the urine, which pulls more water along with it, creating more urine. Once blood glucose levels return to normal, the need to urinate frequently should go away. Number 2, slow healing wounds. The higher blood sugar content in a person with diabetes can interfere with the body's ability to heal wounds. This can be especially dangerous if you have undiagnosed diabetes, as diabetes can cause nerve damage. With damaged nerves, it's harder to feel when an affected area of the body has a cut, scrape, or blister. Since it's harder to know when you have a wound, you're much more likely to develop an infection. Number 3, increased thirst. Excessive thirst is a common early warning sign of diabetes. Especially when accompanied by other early diabetes warning signs, such as frequent urination or vision changes, it's important to get screened for diabetes. High blood glucose levels can cause excessive thirst by way of dehydration due to extra urine output from the kidneys. When the glucose is pulling extra fluids into the urine, it can leave you feeling thirsty. Be sure to drink plenty of fluids to prevent severe dehydration from occurring. This excessive thirst should decrease as blood glucose levels are properly managed and return to target ranges. Number 4, blurry vision. An excess of sugar in the blood can damage the tiny blood vessels in the eyes, which can cause blurry vision. This can occur in one or both eyes. High blood sugar levels can also lead to swelling of the eye lens. This can cause blurred vision, but will improve when blood sugar levels reduce. If a person with diabetes goes without treatment, the damage to these blood vessels can become more severe trusted source, and permanent vision loss may eventually occur. Number 5, unexplained weight loss. Number 6, frequent infections. High blood sugar levels may create an environment for microbes to grow and weaken your immune response. As a result, you may have frequent bacterial or fungal infections. Bacterial infections may affect your hair follicles and nails. Some people develop boils and styes, an infected bump on the eyelid. Staphylococcus, staph infections are some of the most common bacterial infections. Fungal infections caused by Candida, a type of yeast, may occur. Common fungal infections include athlete's foot, jock itch, ringworm, and vaginal yeast infections. The urinary tract is a common site for infections. Diabetes may affect your nerves to a degree where your bladder no longer empties. Number 7, tingling and numbness. tingling and numbness in the hands and feet are symptoms of a condition known as peripheral neuropathy. Over time, high blood glucose levels can damage your nerves. It can also damage the small blood vessels that provide oxygen and other nutrients to your nerves. Your nerves cannot properly function without adequate oxygen and nutrients, leading to tingling and numbness in the extremities. Contact a healthcare provider if you have tingling, numbness, burning, or pain in your hands or feet that interferes with your sleep or daily activities. Managing your diabetes is one of the best ways to help prevent any further nerve damage. Number 8. Dry skin. High blood glucose levels can affect the nerves and blood vessels in your body, including those in your skin. Poor circulation can cause the skin to be dry and itchy. Additionally, fluid is pulled from cells throughout the body to produce enough urine to remove extra glucose, which can lead to dry skin. If you are experiencing dry skin and other early signs of diabetes, ask a healthcare provider about getting screened for diabetes. Number 9. Frequent hunger. Extreme hunger is another classic sign of diabetes. When blood glucose levels become too high, excess glucose is passed out of the body in the urine. Glucose contains calories, which are also lost from the body when this happens. In turn, this can cause you to become very hungry. This extreme hunger prompts you to eat a lot of food to help make up for the calories lost with the glucose in the urine. Number 10. Periodontitis. Periodontitis is a severe form of gum disease in which your gums pull away from the teeth. Periodontitis is more common and severe in people with diabetes than others. The gum disease typically progresses quickly in people with diabetes. The link between diabetes and periodontitis appears to be a two-way street. Diabetes may worsen periodontitis. Likewise, periodontitis is a risk factor for high blood sugar, hyperglycemia, a defining factor of diabetes. Research has linked periodontitis to high A1C levels, which measures your average blood sugar over the previous 3 months. Chronic inflammation is common with diabetes and periodontitis. People with both illnesses have higher inflammatory markers than others. Inflammation may damage the bones that support your teeth, which causes them to loosen or fall out. Number 11. Fruity breath. Fruity breath is a common symptom of diabetic ketoacidosis, DKA, a diabetes complication. Your risk of DKA increases if your body does not have enough insulin to move glucose into your cells. Without glucose, your liver instead breaks down fat for energy. That process releases ketones and acid. Ketones increase the acidity of your blood, which may be life-threatening if untreated. Acetone is a ketone that causes fruity breath in people with DKA. Number 12. Changes in mood. Some evidence suggests that sudden changes in your blood sugar levels, which may occur with diabetes, may cause mood changes. A review published in 2017 noted that post-meal blood sugar changes caused anxious and depressive moods in people with type 2 diabetes. The researchers found that post-meal blood sugar changes might affect cognition, including attention and focus.